Hello, my name is Dr. Mark Stickney, and we are at the Texas A&M University College of Veterinary Medicine and Biomedical Sciences. And today we are going to go through some of the training that you will need for your veterinary science skills program. As we go through, I'm going to spend some time just going through some of the details about what we are doing and why we are doing it the way we are, which involves safety not only for the patients but for us as well. So, our objective today is going to be to pick an animal up off of the floor, restrain it on the table for a veterinarian to do whatever procedures they want to do, and then release that pet back onto the floor in a safe, controlled manner. Before we begin, we're going to wash our hands. And we've all been told since we were little kids that we wash our hands to help keep ourselves from getting sick, getting the cold, getting the flu. It also is a good way to help prevent us from spreading diseases from one patient to the next. So, we're going to wash our hands, and when we do this, we are not just going to get our hands underneath the water real quick and rinse them off and wipe them off on our pants and go on about our business. We're going to wash them so that we are actually doing some good. When we wash our hands, we want to use the water that is as warm as possible without burning ourselves. So I'm going to go ahead and turn on the warm water here, and it's pretty warm, so I'm going to get a little cold water going there as well. There we go. All right, now we're going to get our hands wet. We're going to get some soap on our hands, and now we're not trying to get this done as fast as possible. We need about 15 seconds of actual hand washing to remove all the dirt and debris off of our hands. So that means that while we're doing this, we're going to sing the happy birthday song. And you can sing that out loud so you can entertain people around you, or you can sing it quietly to yourself. So here we go. Happy birthday to you, happy birthday to you, happy birthday to me and you, happy birthday to you. And as we're washing now, we're not just getting our hands and our fingers soapy. We're making sure that we get down into our interdigital spaces between our fingers, because that's where a lot of dirt and debris likes to hide. So we're going to make sure that we really get in there really good. We're going to wash all the way up to our wrists. And now it has definitely been longer than 15 seconds, so we're going to rinse off our hands. Get all that soap off. And then we're going to get a paper towel. And then to do this absolutely correctly, after we dry off our hands, we are going to use the paper towel to turn off the water faucet. And that way we are not going to retouch the faucet that we touched before we had ever washed our hands in the first place. So now our hands are nice and dry, and I'm actually going to dry them off just a little bit more. And we are now ready to see our patient, and we don't have to be worried that we have taken some sort of infectious agent from the patient that we last saw and spread it to this new healthy pet. Now, the next thing that we are going to do is we're going to introduce ourselves to the pet. So, animals, they're in a new environment when they've come to the veterinary office. They're nervous. A lot of them have come to associate this procedure with things not going the way they want, getting their temperature taken, getting vaccines. So before we just reach down and grab that animal and pick it up and scare it more and perhaps get ourselves injured in the process, we're going to spend a few moments and just introduce ourselves to the pet. So this is our Jerry dog today, so we'll call him Jerry. So we'll say, "Hi Jerry, how are you?" And we're going to let him sniff our hand, and we're going to take a look at his body posture and his eyes and see if his tail starts to wag, indicating that he wants to interact with us, or if he tucks his tail between his legs and is very scared, which will indicate that we need to be more careful and go more slowly than we otherwise would. Now we're going to say that Jerry's in a good mood today and wants to play. So we'll say, "Hi Jerry," and we let him sniff our hand, and then we're going to pet his head and pet his body, and Jerry's happy with us, so we're doing real good. Now, when we pick up the animal, I'm going to slide Jerry out so you can see this from a better angle. Okay? What we want to do is we're going to get one arm up here underneath his neck, across his chest, and our other arm is going to come down here behind his back legs and support his behind. And now we're going to be able to lift him up in a way that's going to support his body, and he's not going to feel like he's flailing in space. And just like we should have learned a long time ago, we don't lift with our back, we lift with our legs. So we've got him nicely secured in our arms, and now we lift with our legs and pick him up. And I'm going to come around on this side of the table so again you can see better what we're going to do. So we've placed an arm on his chest and the other arm behind his rear legs. We've lifted him from a squatting position. using our legs and not our back. And now we are going to put him onto the table. We're going to let him stand on the table. And again, this is a point where some dogs are now kind of nervous because they suddenly had a shift in their perspective from where they were happy to now being elevated. So if we need to, we'll pet Jerry and reassure him a little bit more. And now what we are going to do is take his front legs, and we're going to pull those legs forward to encourage him to lie down. Now Jerry's kind of a floppy dog, so he's already lying down. We're going to imagine that he's been sitting here though. And when we go to take his front legs, remember that some dogs are very funny about their paws. Don't just grab his paw and start pulling, because that's just going to make him freak out. He's not going to like it. He's going to start fighting you. Okay? So you want to grab up closer to his elbows, and this is also where it's important that we have introduced ourselves to Jerry, because our face is going to be right in his face, and we don't want him to bite us. Okay? So we say, "Hey, Jerry. Okay, we're going to take his arm. We're going to take his arms by the forearm. Okay, right below his elbows, in front of his wrists there. And we say, "Let's have a seat, Jerry." And we're going to slide those legs out, and that's going to make him sit down. And once he gets to a sitting position, we start petting him again. We say, "Good dog, Jerry. Well done." Okay. Now at this point, the judge is going to have told you whether he wants you to have Jerry lying on his right side or his left side. For our purposes today, we're going to make him lie on his right side. On his left side. We will make him lie on his left side. Now, the way that you are going to do that is that we are going to have his back then roll toward us, so he's going to be on his left side, and as we roll him, one of our hands comes across his neck, and we grab the down leg. Again, we're not grabbing his paws. Dogs don't like that. Okay, we're going to grab his forearm, and we're going to get, here's Jerry's floppy rear legs. We're going to get that down leg on the front and on the back. Again, avoiding those paws. Okay. Now, this by grabbing these down legs and not these top legs, this immediately shifts his center of gravity, and he loses a lot of his leverage and his ability to move. Now here is a key point of restraint that you should remember for the rest of your careers. The less restraint you need, the better. Okay? Every dog does not need you to start really kind of manhandle them and using all of your body weight to hold them down. Some dogs at this point are great to be lying here, and you say, "Hi Jerry, you're a good dog," and they just sit there while you're doing whatever. There are some dogs that are going to resist, in which case you will then tend to lean some of your body weight across their body, just giving them some encouragement to understand that we're going to sit here for a few minutes. And again, it never hurts to speak encouraging words to the dog and tell them that they're good dogs and that they're doing exactly what you want them to do. Okay, so we've got the down legs, front leg, rear leg, a little bit of our body weight across him, and by having our forearm going across his neck, we have control of his head, so he can't turn around and start trying to get in the way of whatever procedures we need to do. Now, at this point, the judge will tell you that you have completed the restraint of the dog, and now it is time to put Jerry back down on the floor. So at this point, we can release Jerry, and we say, "Good dog, Jerry, well done." And Jerry's going to pop up, and he's happy that we finally have released him. So now we're going to put him back down on the floor, and this is again the reverse of what we just did. We are going to put an arm across his chest, an arm behind his rear legs to support the rear half of his body. We're going to lift him up. Remember, we're always lifting with our legs, not with our back. And we will then squat down and put Jerry on the floor. And there we have it. Hi there, this is Dr. Mark Stickney with our friend Jerry again. And in this procedure, we are going to place Jerry in sternal recumbency. And that means that his sternum is going to be on the table. So the sternum, where all of your ribs meet, that is sternal recumbency. So we want to have his sternum be on the table. And we use this position when we are going to draw blood from a dog or give him an IV injection, or when we need to intubate them for anesthesia. So this is an important position to place them in. So we have safely picked up Jerry, and we're going to set him on the table. And remember that some dogs get nervous about this, so we say, "Good dog, Jerry, you're doing great." And now we're going to take his front legs, and we are going to take him by the forearms, and we're going to say, lie down, Jerry, and we'll pull his legs forward, and he'll go into a lying position. And now we're most of the way there because he's in sternal recumbency now. But he's not going to stay like this for long. So at this point, we want to take one hand, and we're going to again place it across his chest and bring his head up close to our body. And now we've got control of his head. He cannot bite or get at a catheter or a needle that may be about to go into his leg. Our other arm comes across his body, and we can pet his ribs, pet his side while we're doing whatever we want to do, and we're going to lean our body weight against him. And this is going to help to keep him in place. And then from this position, there's a variety of different things that you could do to hold his arms in place, or maneuver the rest of his body to allow a veterinarian access to whatever he needed to do. At this point, the judge will tell you that you have completed the procedure, and we will release Jerry. And I will keep the microphone and not give it to Jerry. And we would allow him to stand up, say, good dog, Jerry, you were so good for that. And then we will again safely lift him off the table. Hi there, I'm Dr. Mark Stickney, and this is our friend Jerry. We want to spend a few moments today talking about some of the warning signs that dogs will give you that indicate that they may need a muzzle in order to prevent injury to yourself, other staff members, and to potentially the pet itself. So some dogs are fantastic and great, and they are instantly friends with everybody that they meet. Some dogs are immediately nervous and fearful of new situations and new environments. And some dogs are doing great until you try to draw some blood or do anything that they suddenly decide they don't like, and then they will try to bite you. So here are some things that we're going to watch for. When my first interaction with the dog is going to be just to see what it's doing. Does it appear to be relaxed in its environment? Is the dog looking around? Is its tail wagging? Does it appear calm and want to interact with us? Or is it nervously looking around the room or hunkering down on the table trying to make itself as small as possible? Is the tail wagging? Or is that tail tucked up between its legs as a fear response? Also, does it have its ears pricked up so that it's trying to take in information and again being interested in what's going on? Or does it have its ears back, indicating that it's afraid and wants as little as possible to do with you? Another thing that we're going to look for are its eyes. Are they looking in the same direction? Are they as big as dish pans, or are they nicely contracted, appropriate for the lighting in the room? One of the things that really worries us that you need to be aware of is when the dog has what's called a whale eye. And that's where their eyes are going to be wide open. You can see the white sclera of their eyes, and they tend to kind of look at you from the side. And that means that they want to have as little to do with you as possible. So we're going to keep an eye out for all of those things before we ever interact with the dog. Now, we're going to go up to the dog and we're going to say, hey, Jerry, how are you doing? We're going to let him sniff our hands. And if he is interested in doing that, that's a good sign. He's more pliable. He wants to have something to do with you. But if he immediately draws back or starts to curl up a lip, we're going to stop right there because someone's going to get bit. And I should stress at this point that never believe an owner that says their dog doesn't bite. If they say their dog does bite, that's great. But animals can react in very, very unusual ways when they are out of their normal environment. So always use your best judgment with a pet. So we're going to say that I have come up to Jerry, and Jerry is not happy with me. He's trying to pull away from me. He's giving me the whale eye, and he's trying to curl up his lip a little bit at me. So I don't want to get bit. I've got too much to do today. So we're going to put a muzzle on him, or as I like to call it, a nose warmer. And I say that he'll feel better after his nose is warm. And clients think that kind of sounds nice. So I think that's a good thing to say. So what we want to do is we're going to come up behind Jerry with our muzzle. And remember that the big part goes down across his lower jaw. The smaller part's going to go across the top of his jaw. If I try to put it on like that, it's going to blindfold him, and then you've just got more problems than you wanted in the first place. So we're going to come up behind him. 1, 2, 3. Catch that mouth. The clips come up. The ties come up behind his ears. We snap it in place, and then we can adjust that tightness by pulling on the cord. We want it to be snug. And now About 8 times out of 10, the dog is instantly calmer. They realize there's a little mental switch in them that says, okay, I kind of need to give up now. There's nothing I can do to stop this situation, so I'm going to go along with it. And at this point, we no longer have to be as concerned about ourselves getting injured or the animal getting injured, and we're ready to move on to our exam.
Why would you not muzzle every dog every time anyhow?
Well, we want to avoid having to muzzle them as much as possible because we would like to have the veterinary experience be a positive experience for them. And the dogs are smart, and if they know right away that the place that they're going to means that they're going to have someone put a muzzle on them and they're going to have trouble breathing because of that, they can't pant, they can't lick their lips anymore, that's just not good for them. We want them to have as positive of an experience as possible. And that's where we really want to take advantage of our introduction to the dog, letting the dog know that we're here to help it and be friends with it. And this is also a great time when they are coming in as puppies or kittens for routine wellness checks to give them a little treat at the end of it so that they know that, hey, that guy's good. He's got the snacks.